Okay, so I think we're going to start now. Okay, so hello everyone, and welcome to today's Medical Innovation and Enterprise Undergraduate Open event. So I'd like to thank you all so much for joining us today. My name is Georgia Petri, and I am a current student on Medical Innovation and Enterprise program at UCL, and I will be your chair for today's event. So we hope that you've all had a chance to watch our Faculty of Medical Sciences Open Day video on our website, and that this Open Day Q&A session will address those course-specific questions that you may have and will help you to gain an insight into what it's really like to study the Medical Innovation and Enterprise undergraduate program. So today, our speaker, Pierre Jallat, will introduce you to our Medical Innovation and Enterprise program, followed by an overview of the structure of the program that is available here at UCL. So there will be a Q&A session and plenty of interactive opportunities for all of you to join in throughout today's event. So just to let you know, this session is being recorded and then it will be made available after today's event. So so we are here to respond to any of your questions. So really, please do feel free to send those in throughout the Q&A function on Zoom. So to introduce today's speaker, we have Pierre Jallat, and he is an associate professor at the UCL Division of Surgery and Interventional Science. He is a chartered engineer with a background in physical sciences whose expertise lies in biomedical ultrasound, numerical modeling, and metrology. He's working towards the clinical translation of emerging ultrasound-based cancer therapies based using in vitro 3D models of cancer. So Pierre has extensive experience of working in multidisciplinary environments, both in industry and in academia, to help identify and address unmet clinical needs. So thank you, and now I'm going to hand over to Pierre.
Thanks very much, Georgia, for the kind introduction. So, good morning, everyone. Thank you for attending. So, by the end of this session, what we hope to do here is to introduce you to the unmet needs that this program in Medical Innovation Enterprise addresses. How, as a student, you will benefit from this program. I'm going to discuss with you the need for commercialization of medical and medical translation, and also what it's like to be an MIE student, what you'll be doing on a day-to-day basis in terms of the events that we organize, and also co-curricular activities. We're going to discuss careers as well, the framework that we have at UCL to provide you with a wide range of opportunities, and to let us know, to let you know what our previous cohorts of graduates are currently doing. So I think Georgia mentioned probably enough about myself. So I'm the year 2 lead for Medical Innovation and Enterprise, and I'm also the admissions tutor. And I've got a background in engineering and physical sciences, essentially. Georgia mentioned my areas of research, and they're to do with essentially therapeutic ultrasound, which is a modality which can induce a host of biophysical effects in the human body. So you can essentially go all the way from neurostimulation, treating hopefully one day depression by focusing ultrasound inside the deep regions of the brain, and also carrying out non-invasive surgery. That's already being carried out on the NHS for prostate cancer, for example. So what I'd like to do is to ask you what you think the biggest global healthcare challenges were in 2023. Please put your answers in the chat. Try not to Google or Chat GPT it. Just have a good guess of what these may be. I'll give you a couple of minutes. Georgia, have the attendees got access to the chat?
If I can see, yes, I can.
Okay. Right.
They can use the Q&A as well, so can populate their answers in the Q&A.
Okay. Okay, so COVID. Interesting. So no one. Okay, I'll go through what according to this paper that came out in 2023, what the healthcare challenges are. So essentially, first one is healthcare systems. For those of you based in the UK, you're familiar with the fact that the NHS is struggling. Mental health is a big problem. Sexual and reproductive health, malnutrition, food safety, diabetes, cancer, environmental pollution, substance abuse, infectious disease, and climate change. So climate change, we're talking rather the consequences of climate change. And obviously, all these factors are affecting the quality of life of individuals globally, and we need to find solutions for this. So what do you think the biggest killer in the UK is? And by biggest killer, I don't mean the character in Scream, but rather what disease or condition is the biggest cause of mortality? Put your answers in the chat. Okay, so
Maybe it could be something like heart disease or cancers.
so that was my original thought until I actually found out that it's actually dementia, in England and Wales at least. 37% of all recorded deaths, according to the Office of National Statistics. So we have influenza and pneumonia, which also amongst the top killers, and of course various types of cancers, including breast, colon, rectum, prostate, and lymphoma, make up the rest of the top 10 cases. So it's quite interesting, and this is a consequence of an aging population, where as a population in the UK and in other countries globally, we are getting older, particularly in the West, and we're expecting that we're going to have more and more people living with more than one disease at the same time. And that is likely to cause a number of challenges for the NHS service and any healthcare service. So the solution, well, it's not going to be there's not going to be a silver bullet for this. But this is where programs such as Medical Innovation Enterprise come in. First of all, this starts with scientific research and new and effective treatments, like what me and myself at UCL, me and my colleagues at UCL are doing, starting out with how we can use our knowledge or skills to come up with new healthcare modalities that can save more people, that can be more efficient and cheaper. So it's also to do with timely detection, diagnostics, and intervention, minimally invasive procedure. I mentioned earlier focused ultrasound, which means that you don't actually have to undergo a general anesthetic to be operated upon. So that saves time in terms of hospital stays. We want effective and cost-effective healthcare technologies, less systemic treatments, meaning that you don't want, if you're given chemotherapy, you want it to go locally rather than in your whole body. Personalized medicine, and we also know that artificial intelligence, and in particular machine learning, is having a big impact in the way we address growing healthcare needs. So innovators and entrepreneurs play a key role in this. This is what we aim to do. We want to essentially provide the future biomed tech entrepreneurs with a solid foundation to address these growing needs. I'll tell you very briefly about liver transplantation, organ transplantation. We're having a big issue just in the UK and worldwide finding donors for people who have failing liver disease. And the interesting thing is that we're starting to get to a stage where obesity is, and in particular, bad foods are superseding alcohol misuse in terms of causing liver failure. And given that there's limited availability of transplantation organs, and we have essentially more and more high-risk donors, because as I mentioned earlier, the population is aging, and you'll have effectively suboptimal livers. There are challenges. So then there's also the high cost. So one of the projects I'm involved in is to working with cell biologists, clinicians, surgeons, is to try and look at delivering hepatocytes into the liver, which will help the liver repair itself. And what we do is we're generating a cavity inside the liver using ultrasound and injecting these hepatocytes. So this is still very early age stuff, but this is one way in which as us as scientists try to address these growing needs. So about the Medical Innovation and Enterprise Program, this is really where medical science meets business. And you'll be provided with a solid foundation in entrepreneurship, medical innovation, and creativity. We have close ties with the School of Management at UCL. And you'll also learn a lot about medical sciences in the first year of your program, and from year 2 you'll have the option to tailor this to a blend of bespoke blend of medical sciences and business. So yeah, more UCL School of Management. We work very closely with them as well, and so this again will provide you with solid foundations for your future career. Now, UCL spinouts. For those of you based in the UK, you can see there's rarely a day that goes by without UCL being mentioned in the news. In particular, today, I think or yesterday, it was mentioned because there was, I believe, mRNA treatment for skin cancer that's been pioneered there. And UCL spinouts have attracted £3 billion in investment in the last 5 years. It's a lot, and so it goes to show that doing good science and creating business opportunities and generating wealth can coexist. So one thing we pride ourselves in at UCL is what we refer to as the connected curriculum, whereby we inject our knowledge, the knowledge of our research area into the teaching programs. So you're going to be taught by leading medical scientists, researchers, and educators. And some of the topics you'll learn about is tissue engineering, stem cell therapy, nanomedicine, organ bioprinting, and also non-invasive interventions or minimally invasive interventions. And you'll learn also how to translate these ideas into commercial products that benefit patients. So as biomed tech entrepreneurs, what you will one big area that you'll be involved in is what's known as bridging the valley of death. So the valley of death is this area that sits between the research lab and the clinic. there's a lot of research going on both in the UK and worldwide, but the big question is, how do you get this research into the clinic? And getting funding to do this is a big challenge, and it is getting worse. And it relies essentially on passion and grit of entrepreneurs. It could be engineers. We've had some entrepreneurs, some doctors actually, who set up their own companies to try and, in fact, bring new discoveries into the clinic. And this is how innovators and entrepreneurs can change society. So here's a reference on the so-called Valley of Death, and this author, who's published in Translation Medicine Communications, argues that yeah, there's a current crisis involving the translation of basic scientific funding in the lab setting into human applications, into the clinic effectively. And so I guess what I'm trying to say here is that there is a need there's going to be a growing need for the graduates that this program will produce to address the societal needs in healthcare, which are only going to get more and more challenging. So in terms of the degree pathway, in year one, you'll learn the basics of human physiology, medical sciences, and data analysis. And as part of the medical innovation enterprise module, you'll learn how to critically evaluate existing startups. And that's very important, because you can have people that come along and say, well, I've got this product that's going to save the world, and that's all well, but you need to be able to identify, first of all, whether they have a sound business plan, whether the science is sound as well, and whether this is achievable with the technology and the means that are being put forward by the individual. So year two, you'll learn about molecular medicine, research methodologies, the peer review process, which is the process by which scientific findings get published. You learn how to think critically, and we will go through basics of intellectual property and the translational pathway. So year three, you'll look at financial forecasting, entrepreneurship, and you get to carry out a scientific research project, which I think will give you a good taste for what it's like to carry out scientific research. And the way things are formulated is you will do this very much along the lines of a scientific paper, and there's a large array of projects to choose from across the Faculty of Medical Sciences. You also get to develop a business plan for a new medical innovation startup. And in year four, if you choose to do the MSci, you'll learn about advanced medical science, advanced business skills. You do an advanced research project, and you also do a consultancy project. And essentially, you'll learn how to implement learning in biomedical enterprise. So we have a lot of industrial engagements. Here's the list of some of the companies that we work with, companies and organizations that we work with. We have brought guest speakers from all these companies and organizations, and they are there firsthand to recount their experiences of medical innovation enterprise to yourselves. And it's great thing about being an institution such as UCL, we have, first of all, a lot of in-house talent, but we have close ties with people, and we can attract some of the top guest speakers to impart their knowledge. We also have Sir Robin Jacob, which is an IP expert and former judge, who does a session on the patent system. And we pride ourselves also in developing your communication skills. In a lot of the lectures and tutorials, you'll be asked to present or pitch an idea, or research something in a small group, and then carry out a presentation almost on the fly. The idea being that in this environment, we can give you some feedback, some formative feedback on your performance. And when you really have to pitch something in the real world, then you'll be very well equipped to do so. Sorry, yeah. So in terms of careers, there's a range of sectors where our graduates have ended up. Pharmaceutical, med tech, research, that could be academia or private, and knowledge transfer, consultancy, investments, policy, regulation, governance, and enterprise. So we also have a careers page, which details the opportunities for internships and can put you in contact with companies. And here's a pie chart of the graduate destination. So you can see that so far a lot have ended up in business management and in life sciences consultancy, and a lot of them carry out with further education. A lot of our graduates choose to do master's degrees as well, which is I think a commendable thing, as it enhances your skills. So here's a bit about the entry requirements. So we require 3 A's if you're doing A levels, and for the IB, 38 points. And we also have contextual offers. So for contextual offers, it's BBC for the A levels, and 30 points for the IB diploma. So I'd like to thank you for your attention, and now we can proceed with the Q&A. Feel free to switch on your cameras, since there's, I think, a limited amount of you. It'd be good to see you face to face. And yeah, just raise your hand to ask a question.
Okay, just to maybe quick start the Q&A, I'm gonna answer some frequently asked questions that a lot of people ask. So, people often ask for any advice that I would give to someone who's thinking of applying to the program or things like that. So, I would say, if you're applying to MIE, I think you can have a very broad range of interests, as in you can be unsure about where you want to go in the future, as in, as Pierre just explained, there are so many different career paths you can take. It's about what you do with the degree, because it gives you a really good background in medical sciences and a really good background in like entrepreneurship and things like that. So maybe if you have interests in like medical technologies, or like shaping the futures of medicine, or starting your own startup, or things, anything like that. Yeah. And then another question is what it's like to be a student living in London. So, I'd say it's such an amazing opportunity, like being a student in such a big city, like literally the UCL campus is so central. So we're just like a 10-minute walk from some of the world's most famous landmarks, it's really cool. Like, you can just, you're bored, you can go see Big Ben, like there's so much to do. There's always something new, a new restaurant to go to, a new museum to see, a new place to see, a new market to go try. It's so much fun. You never get bored. And it's such an international city as well. So especially for international students like myself, you will always find like members of your community wherever you go. And everyone is so welcoming, so accepting. It's such a nice environment. Even at UCL specifically, it's a super diverse university. Like, um, I'd say most of my friends are all from different nationalities, like yeah, and everyone is so welcoming, so kind. Like you will definitely find your people. So another question that people often ask is about like when it comes to making friends. So I found, at least for me, I made most of my friends from my course and my halls, my accommodation in first year. Um, so my accommodation in first year was really close to campus. I was in Ramsey Hall. It was a really nice accommodation. Like it was really fun. It was really nice. Everyone was really friendly. It was a big hall, so there was a lot of people. There was always something going on. Yeah, and it was right next to campus. And then joining societies as well really, really helps. Like, um, I didn't join a society in my first year because I was so caught up and so busy with like I don't know, my friends from my halls and my course. I thought there was no need. But then in second year, and I'm currently in second year, I decided to join some societies, and I've made some of the most amazing memories. I've made some really long lasting friendships. Like I can't emphasize how important it is to go out and join societies, because I'm only saying like so much because I realized that I did miss out in my first year. Um, yeah. And like a tip for making friends as well. It's always really daunting, really nervous, like it's so scary, you don't know anyone, you don't want to like just go up to people. It's very uncomfortable situation, but you just have to keep in mind, and at least this really helped for me, that everybody is in the same boat as you. So everyone is just as nervous, everyone is just as scared, everybody wants to make friends, so don't feel uncomfortable to approach people and just like say hi, how you doing, see what people are doing that evening, or if they want to go for lunch the next day. Like most people will pretty much always say yes, and like they're down for anything, especially in your first year. You're a fresher, and most people's open-minded like attitude to like making friends doesn't change. So I'd say that's something important to keep in mind. Okay, another question that gets asked a lot is what has been my favorite thing about the MIE program. So I'd say that we get loads of guest speakers, and it's so interesting because we're hearing from all of these different people's perspectives. They're all leaders in the field, so you're really getting like the best quality information, right, like straight from the horse's mouth. It's really unbeatable because it's such a nice experience. Okay, let's see what you guys have asked. So, how does the 38 minimal entry requirement for IB compare to actual entry cutoffs for the class 2023? Um, so
So
I think, sorry, Pierre, go ahead.
yeah, so I think I don't have that exact information at hand. I know that for the application process, you have to have a recommendation saying that you're expected to meet the entry requirements. When it comes to actually selecting the cohort of students, I understand there is sometimes some leeway. I don't know the exact details of that, but for example, for A levels, I know that if you're not predicted 3As, unfortunately, you can't apply. I don't know if this answers your question. Probably not exactly, but if you send me an email, I'll put I can see if I can get that information for you. So the other question was what's the difference between biomedical engineering versus MI at UCL? Okay, so I think I'm in a good position to answer this. So the biomedical engineering course is taught in the Faculty of Engineering Sciences, and it's affiliated with the Department of Medical Physics and Biomedical Engineering. So this is actually an engineering course where you need to have a strong foundation in maths and physics. And if maths and physics are your thing, then I would go, and you want to do healthcare, I would go for an engineering program. If, on the other hand, you're more geared towards medical sciences, entrepreneurship, business, innovation, then medical innovation enterprise is what you're after. So in terms of healthcare consultancies, so there's one of our graduates who secured, who's a life sciences associate at LEK Consulting in Paris. So hopefully this answers your question.
Um,
I'm, yeah, go ahead, Georgia.
I was gonna go for the another like frequently asked question. Um, so recommending any extracurricular activities that could help your application or reading activities. I'd say being involved in just being involved. I mean, again, this I don't really know that much because this is more about admissions, but I feel like for me, at least my application, I did a lot of extracurriculars, and I know that a lot of my friends on my course did. Whether it was like, student council or even sports. Um, I like maybe some sort of showing that you have a genuine interest in like medical sciences or entrepreneurship, maybe taking part in like some business competition, like a business plan writing competition, things like that. Like I feel like these are often helpful.
Yeah, thanks for that. To further that, what one of our another one of our graduates was at Roche Diagnostics as well. So it's yeah, I mean, we've generally speaking, they've secured gainful employment. Um, okay, I can write my email in the chat. Right, there you go. Hopefully that comes through. So that was in the Q&A. Oh yeah, here. Okay, great. Okay. Any further questions?
There's none in the Q&A. Um, maybe some, does anyone else have any last questions? It could be anything about like student life, about the course. I mean, if you can't think of anything now, don't worry. You can always, I'm sure you can always email, and there's no problem with responding to that. Um, Maybe I could even give my email address if that's helpful. If you have any like student living related questions. Yeah, but I think since we might be out of questions. Oh wait. Oh, what's the connection with UCL's business school?
Uh, the connection is that well, we UCL Business School. Well, we have close ties with UCL School of Management. Hang on, let me try and answer that question. Yeah, I think you're probably referring to UCL School of Management. There's UCL Business, which is a separate entity as well, but that's it's another issue altogether. So what happens is UCL School of Management allows us to our students to apply to enroll in most of their modules, and that means that if you want to tailor your degree program towards something that's more business orientated, you get to do that in the second year. There are, I think, some compulsory modules in the School of Management.
Yeah, there
Georgia,
are.
you probably want to say more about that, but yeah.
Yeah, so in first year, you don't have any modules with the School of Management, but in second year, we have two compulsory modules, and then you have two optional modules. So the two compulsory modules are understanding management and entrepreneurship theory and practice. Um, and I think, yeah, if you've never done business before, or if you have done business before, they're both really great modules. Like I personally have never studied business, but I had friends in my course who had, and we all found it like challenging, but like not impossible. Like they were good modules, and really got to think outside of the box, get creative. Very nice. And you could also choose optional. So if you wanted to do more of a medical sciences route, you can choose medical science like based optional modules, or you can choose optional modules in the School of Management. Some of those were competitive strategy, there was accounting. I mean, I'm not too familiar with them because I chose medical sciences ones. But yeah, there are, and then the same thing is in third year where we have this one I'm not too sure about next year. I think we have two compulsory School of Management modules. And then again, you can choose three modules. Again, you can choose School of Management if you prefer to do more business, or you can choose more medical sciences or from the Division of Surgery. Yeah.
Yeah, so also we've got some new modules that we have access to. So for example, there's the ethics of artificial intelligence, which is quite topical. Digital conversations and marketing, innovation management, strategic project management. So quite a few there, which oh yeah, decision and risk analysis, international strategy as well. So there's a lot there. And it is you're not always guaranteed a place, but you apply and we usually find a way, hopefully, to navigate sometimes the complex timetabling system. But there's a lot of choice there.
Let's see, any more questions?
Can many students apply for one-year master's degree in management? Yes, absolutely. I've written references for some of my students who've gone on to do various master's degrees, and global healthcare management. That's a common one. There are various universities that offer such programs. So yes, absolutely.
Okay, any more questions? I'll give you a second to type them in if you have any. Okay, well, it seems that there are no more questions. But yeah, so my email and Pierre's email are in the chat on the Zoom. Oh wait, okay. Not a problem. Thank you for attending. Yeah, so if you have any more questions, yeah, feel free to send me an email or Pierre an email. Yeah, don't hesitate to contact us. And so I guess we'll be closing the session. So I would just like to thank you all so much for joining us today. And also thank you for your questions. And thank you to Dr. Shala for an excellent session. This has been really lovely. Thank you all so much and have a really great day.
Thanks, everyone. Bye.
Bye-bye.